Hi, my name is Liv Swanger and I'm the pharmacist. The patient today is Luke Garner. He was born on March 5th, 1992, which makes him 28 years old. He is currently insured through Blue Cross of Idaho, which I did use to help formulate my medication regimen today. So, some subjective information about him that I thought was pertinent. He does have a past medical history of depression and is currently taking sertraline. No alcohol or illicit drug use or HIV high risk behavior reported by the patient, and he has no known drug allergies. Some objective information is the patient was diagnosed 2 years ago with Hep C, which is the main point of today's appointment, and it has currently gone untreated. He potentially contracted it from his previous IV drug use of meth and heroin 10 years ago. And as of last May, he has quit IV drug use, is in overall good health, is going to support groups, and is finding it very helpful. He does have an increasing BP though, and his last blood pressure is 143/71. That shouldn't really be addressed today, as that's not the main concern, but it should be noted. All labs were within normal limits, although he did have an elevated ALT, which is indicative of stress on the liver. And his last obtained hepatitis C quantity per PCR methods was 4,031. He does have a listed genotype of 2B. The patient also tested negative for HIV and does not have immunity to Hep B. And I thought both of those were pertinent, especially with the HIV in accordance to his treatment today. So a brief assessment. The initial visit for his Hep C was performed on March 26th by Porter Rubin, MD, and Danielle Soili, PharmD. And today's visit is really a continuation of that appointment. So labs were drawn then, and we currently now have his genotype for the Hep C, so we can optimize his therapy that way. We also got all of the baseline labs, which I'll discuss in a minute. But he was diagnosed 2 years ago with Hep C, but did not have adequate resources to get treated. And some goals for my treatment regimen for him today is one, to educate him about Hep C and familiarize him with what it is, about it, transmission of spread, things like that. And also other hepatitis viruses, how to avoid them, and that Hep C is treatable, but Hep B isn't. So just taking preventative measures to prevent Hep B infection for him. Also, the prognosis of Hep C, it is treatable. His treatment plan specifically, and connect him with a social worker if he has any other community resources. With him having a history of IV drug use and some other ailments, I think it's really important that he has the support that he needs not to start using again or things like that. Additionally, is promote compliance, because my therapy for him is only 12-week regimen. Long term would be to prevent further liver damage, which his liver is obviously under stress from his ALT values. And I'll also prevent cirrhosis and further down the line, the development of hepatocellular carcinoma, which can be seen in long-term chronic Hep C infections. And also, we want to discuss with him that there is a cure, once again, for Hep C. And the goal at the end of this is for Hep C to be undetectable in his bloodstream via lab draw. And then also prevent reinfection with Hep C and other viruses, including Hep A, Hep B, and HIV. So for my plan for him today, and I think it should be noted here that anyone who comes in with a Hep C positive test is recommended for treatment, regardless of what age they are, regardless of what other comorbidities they have. If they do have Hep C, they are recommended for treatment. I did look at his insurance, and Harvani does not cover his genotype, even though it is covered by insurance, so that's not appropriate. The Mavorette, which I initially wanted, and is not covered by his insurance. And the Epclusa is covered by his insurance, and it covers his genotype, which is specifically 2B. And so Epclusa is sofosbuvir 400 milligrams and velpatasvir 100 milligrams, and the regimen is 1 tab PO QD it is by mouth every day for 12 weeks. And more specifically, it is an NS5A and NS5B inhibitor and is appropriate 12 weeks for treatment-naive patients. And I will counsel him more specifically on certain parts of his regimen, but he does, for the purpose of his healthcare providers, he does have appropriate kidney function, and we do not need to worry about a Hep B reactivation, which is a black box warning for this medication, as he's not infected with Hep B. And additionally, I will suggest that he stops his PPI, his proton pump inhibitor, omeprazole, because this does have a drug-drug interaction. And then we can reevaluate that at the end of his therapy. The patient is not taking any medications of concern, but I think it's worthy to note that there is a pretty severe drug interaction with amiodarone. So for the sake of his treatment, what we would prescribe, further issues that may happen down the line in the next 12 weeks, amiodarone is not appropriate, as it can lead to bradycardia and a subsequent cardiac arrest, which we do not want and would like to avoid. For monitoring his baseline, we will need a quantitative HCV viral load and genotype, a CBC-INR calculated GFR, hepatic function panel, which have all been determined. Thanks to Dr. Rubin and Dr. Soili, we have all of those labs, which we are needing. And my suggestion is at the end of his therapy, we redraw all those labs just to make sure that everything is within normal limits. He has successfully gone through the treatment without any outliers to his labs. But more specifically, we should put an emphasis on the Hep C viral load, because at the end of the day, this is the point of therapy. It's to make sure that his Hep C viral load is undetected, which therefore would indicate curative measures have been taken for his Hep C. And as for follow-up, as time goes on and as we have seen more evidence come to fruition with these medications, there's not a real necessity for the patient to be checked every week or to come in for, weekly appointments. It's actually become a little bit more lax. And so even though he may not require any appointments while on this treatment regimen, I do think that it's important that he does feel supported, and that if he does want to come in or he does have questions, to support that. But as far as my follow-up and what I want to do is I will check in with him on the first week. I want to make sure he's not having any drug interactions. We won't have any foreseeable issues with compliance. And then I'll check in with him at the 6th week as well, which would be the halfway mark with his treatment. And once again, verify compliance, verify how he's doing, how he's feeling, see where his motivation is to continue this therapy, which hopefully is good. And then also contact him at the 8th week. Once again, to check up on him, but also to schedule a time that once he has completed this 12-week regimen, that we can get him in for those lab draws and see if he's undetectable for Hep C. And noteworthy, and for his wellness, is immunizations that are required. I would suggest Twinrix, which is a Hep A, Hep B combo, and he does not have any notable immunity to those. It's a 3-dose series, so you're at 0, 1, and 6 months that we want to give that. And then a pneumococcal vaccine is not indicated, as he has quit smoking. So for the patient, I am now leaving the healthcare provider circle and going to counsel my patient. So, hi, my name is Liv Swanger, and I'm a pharmacist here, and I'm going to be seeing you through your Hep C curative treatment regimen. The purpose of this counseling is really to make sure that you understand this medication, its purpose, what it's going to do for you in curing your Hep C. And the name of it is sofosbuvir and velpatasvir. The brand name of it is Epclusa. If you see either one of those, this is the same medication. Dose and therapy is 400 milligrams of the sofosbuvir and 100 milligrams of the velpatasvir, and it's taken by mouth once daily, and it is a 12-week long therapy. So there is an end in sight to this therapy, but taking it at the same time once a day, every day is appropriate. They are pink tablets, and depending on which medication you get at the pharmacy, they're going to be pink, and they're either a little diamond shaped or they can be round, oblong, round. And so some special instructions with this medication: it can be taken with or without food. So whatever's your preference and whatever is going to promote you taking this medication every day is important. However, I did notice on your file that you're taking omeprazole, or it's also known as Prilosec. It's an over-the-counter medication for heartburn. And there's actually a drug interaction that we want to avoid with your omeprazole and with your Epclusa. So what I'm going to suggest to you is to stop the omeprazole completely, and also avoid heartburn foods that, may give you some stomach irritation that causes that heartburn. And this is a 12-week regimen, so hopefully you can get through it without too many hardships. And I know that pizza sauce is probably super yummy, but if we could avoid it for the next 12 weeks, that would be awesome. Also, it's important to talk to your doctor and your pharmacist before you start taking any medications, whether that be over-the-counter or other prescription medications, which we should be collaborating as your providers. But we really want to see you through this treatment therapy, and we want to support you in that. And so avoiding any medications is something that you can do on your part to also help us to make sure to see that it's successful. Obviously stated, we want to make sure to avoid alcohol and NSAID use, as this can cause a hardship on your liver, which we are trying to treat. Some side effects with this medication is feeling fatigued or having a headache, and those were the most common. However, I want to encourage you that if you are worried about anything, or you're feeling like you're having other symptoms of concern, please feel free to call us, and we can work on that and see if there's anything else that we can do. But seeing you through this therapy is our goal. If you miss a dose, try to take it as soon as you remember. And if I could encourage you to either put like an alarm on your phone, or having maybe accountability with someone else to make sure to take it. It's really imperative that this medication is taking once a day, preferably as close to the same time every day as possible. So whether that be with breakfast, whether that be with dinner, either or works. But take the dose as soon as you remember if you do forget. Also, you want to store this in a cool, dry place. Additionally, I would store it where it's not likely to be damaged or taken or lost or anything like that. These medications can be pretty expensive. And so avoiding, losing it and things like that, just to make sure that, we don't have any issues or interruptions in your therapy. And also, if you have any questions, please let us know. Myself as a pharmacist, the doctor, we're all here to support you, and we want to see you through this, as we want to see your Hep C be cured. And here's some handouts on the medication from LexiComp, and thank you for your time. If you have any questions, call us at this number. Thank you.